Hello everyone. Hello everyone. Quick presentation here. This is going to be on the treatment of nausea and vomiting in pregnancy. Some of this will be review and or overlap from ICM. As always with these smaller lectures, please focus on the medications for my exam, which is probably, you guys already know that. Hey guys, I can hear you guys rolling your eyes at me. Yeah, you need to know the drugs. Okay. A little bit of background introduction. So morning sickness is what is called by lay public, or rather nausea with or without vomiting is common in early pregnancy. So you guys probably again know this already or have seen this in the movies, on TV shows, with friends, family. It is something that is unfortunate part of pregnancy, especially early pregnancy. The good news is the more severe vomiting is more rare. It's more infrequent. It still can happen, and again, in your ICM, you'll get into the nuances of kind of when and where you have to worry about that and you have to deal with it. But so, majority of women, this morning sickness is going to resolve in the middle of their pregnancy. I know some women, and every year in class, there's a couple women that raise their hands like, when I was pregnant, whatever. But yeah, so when they were pregnant, they had morning sickness all the way until they delivered. So yeah, it can occur. And like I said, typically it's self-limiting, so to speak, and it's not severe, and it typically does not require hospitalization. But again, those are, I'm just saying, just in general. So it will be patient specific. As far as the management is concerned, you can start with lifestyle modifications as always. There's some medications over the counter and prescription, which we'll get into. Hint, those will be the ones for the exam. And you typically can do this outpatient, but you may have to go inpatient, which we're not going to stress about too much here during this presentation. And like I said, I believe that'll be something that you guys will be covering more in detail in your ICM course. So the treatment goals. So of course, the number one treatment goal here, and I'm kind of laughing here because I think you guys all know this, and again, if you've ever been around anyone who has morning sickness, is to stop the morning sickness and or reduce the morning sickness and reduce the stomach upset, reduce the nausea specifically. So that can sometimes be easy as avoiding certain environmental triggers or certain foods. So just personally, from my wife, for example, when she was pregnant with our daughter, for whatever reason, chicken was something that for the first half of her pregnancy, she just could not stand the sight of. She didn't like the smell of it. Cooked, uncooked, with masala, spices, whatever, didn't matter. Any recipe, all of her old favorite recipes didn't matter. So I just didn't eat chicken for, or I was like secretly sneaking off. I gotta go to the grocery store now. Come back with all this chicken grease all over my face. She's like, "What have you been up to?" Like, nothing. No, but I don't eat that much chicken. But yeah, so we did not eat chicken just because that was one that it was pretty easy. Luckily, it was just chicken. Was one of the ones for her morning sickness. But so sometimes it can be something as simple as that, avoiding certain foods, certain scents too. I know, like again, not to be just overly personal, but with my wife, there were certain perfumes, certain fragrances that would drive her crazy. So luckily, it wasn't anything with me because that would have been bad. But yeah, so luckily my smells were okay with her. But yeah, so that can also be sometimes too. You'll hear. I've had some coworkers who've been pregnant where it's like, depending on the air freshener they use at the pharmacy or whatever, it's like they're not having it. Like, let's unplug those plugins, get rid of that Glade or whatever. Because it's like, I don't want my coworker vomiting all over the place. So anyway, so that can be some of it. And then definitely if the vomiting is an issue, you always want to be thinking about your electrolytes. You want to be thinking about that. And then if it becomes very severe, very persistent, then you do need to be worried about other things. So again, not going to get into that in too much detail. And then as always with any pregnant woman, you are always going to be concerned about the fetal effects. So you're always worried about the baby. So you definitely want to minimize that or try to mitigate that. So the good news is for this presentation, we have an algorithm we can follow. So I recommend this algorithm as far as you guys can use it for ICM or use it for whatever, use it for rotations, etc. So I definitely encourage you guys to read through this. And as far as my exam is concerned, definitely put a star or highlight anywhere we talk about the drugs. So we have some medications listed throughout here. Definitely those are the ones you're going to want to focus on for my exam for testing purposes. But as far as this full algorithm is concerned, check with ICM. I don't know. Maybe some of this will be good for ICM. Maybe it won't. I don't know. Acupuncture. I mean, acupressure. I don't know. I'm sorry, guys. I always flip up in my brain acupressure and acupuncture. And so I can read, by the way. So I know some people will email me, can you read? No. No one, luckily you guys are all professional. You don't send me any disrespectful emails like that. Like, dear Dr. Strong, can you even read this email? I'm typing you right now. Yeah, so I can read. So it says acupressure. So sorry about that. Acupressure is interesting in that, long story short, with all the research they've done, it's not been found to be effective, quote unquote, with the research, or the evidence-based medicine is not there. Is the best way to say it. See, sounds smart, but it is something that is sometimes preferred, or rather, patients swear by it. They like it, so it may technically be a placebo effect. But I'm kind of whispering here. I don't know why I'm whispering. No one's no one's here with me. But no, okay, on the down low. No, but yeah. So placebo effect's okay sometimes, and especially with the pregnant woman, if they don't want to take a medication, then I'm all for it. They come to the pharmacy, they're looking for non-medication. They're scared about, or they don't react well to medication, or they're scared about exposing their unborn baby to medication. Those are all legitimate things. So, kind of take home point with this acupressure, there isn't the evidence-based medicine that shows that it works. However, it also, with the evidence, didn't show that it really hurts anything. So it is something that, I mean, and like I said, if they come in the pharmacy and they're looking for, there's some products here, I'm definitely not going to be like, oh, it doesn't work. Evidence-based medicine says save your money or whatever. I'm not going to be get attitude with a pregnant woman if she's just looking to like wear a little wristband or something. But so anyway, so that's the take-home point. I had some students in the past ask me about it. I've also had other students in the past that they swear by these. So you guys are near the Gulf Coast, aka Third Coast, aka shout out Third Coast. You guys are near the Gulf Coast, and I know some of you guys like to fish or go out on the boats and go out to the ocean and stuff. So there's been a handful. I've been surprised in 3 of my different courses where there's students who swear by these wristbands that you wear that use acupressure. So I don't know. I mean, again, if I had seasickness, you can take medications and stuff for seasickness, but I don't know. I might try it, but that's unscientific of me, unpharmacist, evidence-based medicine of me. But I don't know. Unless it's like super expensive. But so here is the acupuncture pressure. I said it again. Acupressure point. It doesn't help too. A couple days ago, one of my wife's friends' wife is an acupuncturist, so she showed us her clinic and shows us what she all does. So I guess I have that in my mind. But anyways, you can do acupressure here, and it shows you where it is there. And then this is the C-band. Yeah, C-band. High five. Boosh, boosh, boosh. This is the natural choice for nostril relief. You may have seen this. They have other products too, by the way. This presentation is not sponsored by C-band. If you go on Amazon or whatever, they make all different brand names of this. I just like this image, and it just shows you where they come in like all these cool funky colors, I guess, but then they have this white thing is basically and they're all a little bit different, but it's basically a hard piece of plastic, some kind of ball or something. Like the one of the students, she showed me hers in class, but because I guess she was gonna like go on the boat later, that I don't know why she had it with her. She had it in her backpack, but it had like a plastic ball and it was just like a normal wristband with a little ball, or like a little piece of plastic, little pointed piece of plastic, whatever. And it's basically the piece of plastic, and the tension of the wristband is supposed to it's supposed to push on this acupressure point, and that's the idea behind this C-band. Another natural remedy is ginger root. So this is also another one that they'll recommend in different cultures. So part of the reason I have it here too is in my wife's culture that they use adawa, or adawa, padawa, nun chadawa. No, that's a nursery. That's a silly little rhyme in Nepali. Shout out to the one Nepali student who maybe understands my horrible accent. But yeah, adawa, aka ginger root, is what they use for all kinds of stomach ailments, and this is kind of traditional natural medicine all over. But it's also, you can safely use it in pregnant women. So they make teas, but you can just get this at H-E-B or whatever grocery store, peel it, smash it up, put it in some hot water. Boom, you got ginger tea. You can also cook with it and eat it and do other things with it too. So yeah, we cook with it all the time and eat it and everything. We grew it too in the valley. In South Texas, it will grow. So I don't know if any of you guys want to try growing it. But anyways, yeah, this is another remedy that you may have some of your patients ask you about. So again, over the counter. Again, with the evidence, it's a mixed bag as far as evidence-based medicine. It typically has, it's like the wristbands or the acupressure. Really no harm, maybe some placebo effect, but so again, in the pharmacy, if people ask for ginger tea, depending on if I'm at a grocery store or pharmacy, I'm like, oh hey, we sell fresh ginger root over there in the produce section. Shout out to my friends over in the produce section. I always make friends. You always, anytime you work in a grocery store, you always gonna make friends. This is a pro tip, by the way, so this isn't on the test. You always gonna make friends with the produce guys because they always have the freshest produce hookups. Like they know when things come in and stuff. So when I worked at HEB in the summer, in the pharmacy, I was friends with a couple guys over there. One was Raymond. Shout out to Raymond. I don't know if he's still at HEB or not, but yeah, Raymond was over there, and he would always be like, we got the new shipment into peaches, Charles. We got it, or whatever it was, and it was delicious. so anyways, that was totally side note there, but that's also something that you may come across. Preggy drops. So Preggy drops are another thing that are over the counter, a natural, quote unquote, natural way to ease morning sickness. These, again, well, it kind of depends on what pharmacy you're at. So like in Oklahoma and in Texas, certain parts of town will be, I'm not going to say like more hippie or whatever, but or like certain parts of Austin. But there's definitely going to be your certain, I won't say parts of town, there'll be your certain patients that are interested in kind of a quote unquote drug-free solution. So I put these here because my wife's never taken these or whatever, and I hadn't heard of them until I was a pharmacist or worked in a pharmacy. But they originally had Preggy drops. I gotta slow down to say this, and then they make Peggy Pop drops. Sorry, it's kind of a tongue twister there for me. Preggy Pop drops. Okay, gotta slow down. Which they're lollipops, and then they look like little cough syrups. As far as natural though, I don't know. I'm not super crazy about ingredients, but this is dried cane syrup, cornstarch, citric acid, natural flavors, natural colors. Probably not bad. It's kosher too. I don't know if that's important to you or not, but these basically they're just hard candy. It's basically what it is. So you end up paying more. So depending on the patient and how much time, I might just say, hey, is there any kind of just hard candy that you like that maybe has different ingredients or whatever. But these are basically, it's just like a lollipop and a hard candy, but they put this pregnant lady on here, and then they put they trademarked, registered the name, and they said doctor recommended. I don't know what doctors recommend this, but it's just basically candy, which isn't bad, and hard candy can help with the morning sickness. Again, evidence-based medicine isn't there, but placebo effect is probably definitely there. So if a woman says, oh, if I suck on a peppermint it helps my morning sickness, then by all means, suck on a peppermint if that's, what helps you. So same thing with these Peggy. Let's just pretend her name is Peggy. So Peggy's Preggy Pop Drops. How about that? Let's just pretend. All right. So, like I mentioned before, definitely if women should be as mindful as possible to try to be aware of what triggers. So is it a certain type of food? Is it a certain scent? Is it a certain environment? Is it a certain type of clothing? I know too there's been women where maybe tight clothing or whatever. All that stuff is definitely things you want to start with as far as lifestyle modifications. We talked about acupuncture, acupressure. But like I said, however, doesn't seem to be much harm. And so why not? As long as the patient can afford it and if they're interested in it, they're gung-ho about it. Hey, why not? There are some medications. There's some prescription medications specifically you can try to employ or to prescribe. We have Diclus and Bongesta, Bongesta. Those are both a mix of vitamin B6, peroxidine. You notice this in there, different strengths. And then in a first generation antihistamine, doxylamine. Notice on both of those. So those are both over the counter. Like I said, antihistamine over the counter and then vitamin B6 over the counter. However, The combination is only prescription. So these two right here in bold are prescription only, so if you want to make a note about that. We have the dosing there as usual. Don't stress about the dosing for my exam, but definitely make sure you know the drugs here. So know that the combination is prescription only, and then know that you can prescribe them, or rather the patient can get them over the counter without a prescription. So that's with both OTC, over the counter. So those have been shown to work, and like you'll see them inpatient. I've seen them being prescribed inpatient, outpatient, and so they do have some evidence behind them that they do work. As far as specific mechanism of action, I had students ask me about it. They're not really sure. Well, antihistamines are good for nausea and vomiting, so that is why. But as far as why the B6, they're not exactly sure why B6, but antihistamines, and then the combination too specifically, kind of, they're still, it needs to be fully elucidated. It is not fully elucidated. If it persists and if it doesn't respond to those, you can go with Benadryl, generic Benadryl, which is diphenhydramine, again over the counter, or Meclizine, over the counter as well, every 6 hours, every 4 to 6 hours. So that is something to think about. However, the big disadvantage of these, and the same thing with this one too, if you guys remember, first generation antihistamines is sedation. So, if they have morning sickness and they're taking Benadryl in the morning, depending if they have to work or go to school or whatever, if they need to be alert or if they have other kids they're taking care of, these may not be a good idea. But anyways, past that, you can go to the dopamine antagonists. So we have the older antipsychotic, they're prochlorperazine and the metoclopramide, which we've talked about a couple times, but we'll talk about probably again in the future. But those can be used. Metoclopramide is generic for Reglan, which you may have heard that. Past that, so kind of, again, for more severe nausea and vomiting, you can go with ondansetron, which you guys will remember from the GI module, but you can't go with it just generic for Zofran, so that's something to think about. Again, if it is severe, and they do have severe dehydration, electrolyte abnormalities, you definitely need to make sure they're inpatient and getting their proper fluids. Thiamine, the vitamin thiamine, will help if a person has Wernicke's encephalopathy. Again, more severe case here, not going to be your... This is interesting too. You can also do these gut rest during hydration, followed by reinduction of oral intakes of liquids with bland, low-fat foods. That can also be a strategy to help. And then rarely you'll use steroids. Again, this is going to be a really case-by-case, probably inpatient setting. So don't stress about that too much for my exam for testing purposes. Just want you guys to focus on these drugs here. Oh, okay. Oops, went a little too far there. Sorry about that. What was that last one? Okay. Sorry. In a rush to get this done with, I guess. No. Yeah, and this is just more about the more severe cases as far as their inpatient strategies. So you can guys read through that. Other thing too, always note with all women of childbearing age that they can take prenatal vitamins with folic acid. So this will help the nausea vomiting during pregnancy, and it also helps prevent neural tube defects. So again, I have some patients ask me too, like, oh, I should start taking the prenatals after I get pregnant. It's like, well, no, I mean, you don't always, obviously you guys are all adults, you don't always know when you're going to get pregnant. But if you ever have a couple that is planning the pregnancy, always encourage the woman to take prenatal vitamins, because prenatal means before you're pregnant. So again, that's an ideal situation, but it's also okay to start it once the woman finds out she is pregnant. So anyways, that is the last slide, as you guys already saw. Thank you guys for your time and attention. I do appreciate it. Thank you guys for also putting up with all my mispronunciations and all my Peggy pop tongue twister stuff. But anyways, I appreciate all that too. Thank you guys. And as always, feel free to email me any comments, questions, feedback. Thank you guys. Talk to you later.